Hello friends, welcome to yet another episode of Evidentale where we discuss evidence-based dentistry. We all know that interdental cleaning is important because most dental diseases start interdentally. So how should we clean the interdental areas? Should we use a floss or an interdental brush? Floss is useful no doubt, but most patients find it difficult. And if something is difficult to use, the motivation will not be sustained and they give up. At the same time, interdental brushes are more user friendly and it is more likely that a patient will continue using an interdental brush instead of a floss. So where to use an interdental brush? First of all, patients with periodontitis. If used properly in periodontitis, in the interdental areas, apart from removing the supragingival plaque, the interdental brush can also remove plaque below the gum line up to 2 millimeters. Next, patients with different restorations, fillings, crowns, bridges can use interdental brushes. And lastly, interdental brushes are excellent carriers of medications interdentally. So you can carry fluoride to arrest caries in the interproximal surfaces, and you can carry chlorhexidine gel interdentally. This is especially useful in cancer patients who have developed oral mucositis and dry mouth, and interdental tissue health is critical. There they can use an interdental brush and carry chlorhexidine gel. Thank you for joining. Please like the video, subscribe to our channel and share this knowledge with your friends. See you soon in another episode.